So I have another good friend, Nivean, who always keeps thinking out of the box. I just wanted him to share how he thought out of the box and how he was able to make that into a product so that the youngsters here would also think like that in the future. No, unless you do that, you may not see a lot of changes which we see happening now. So we need to work on that, and I think definitely you need support from a lot of people, maybe from engineers, industry, but he's going to share his journey.
Thank you, sir. So, respected teachers, senior ophthalmologists, my dear friends. So, I'm Dr. Nivean. I'm just going to talk to you about how you can bring your idea to clinical practice. And there's no better way to share it with my own journey about the CMT Flex IOL. So, as you all know, I think you all do your thesis and you all come up with different innovations and ideas. But then there should be a long-term goal, or you should have a long-term plan for whatever you have. It's not that after 3 years it gets over or 1 year it gets over. So always try to look for a longer, can you just cut out the volume? So as far as all of you know about aphakia management, more than 30 years we have been having different methods like the claw lenses, anterior fixated, then posterior fixated, then sutured lenses, then the glued IOL, Yamane, so all these were there. So me being an anterior and a posterior segment surgeon, I was always interested in PCR and secondary IOLs. So what fascinated me was the idea, why not have a IOL specifically designed for this kind of an aphakic treatment rather than using IOLs and modifying the techniques. So that is the thought that came to my mind that led to this. So always start drawing, scribbling, but don't forget where you started. So this is how the journey started of the CMT Flex. Like I want something different. So the specialized T-shaped, we had different designs. So that's how the idea begins. But then idea alone is not enough. So what I've learned is like if you want to travel alone, you can run faster. But then if you want to go longer, you need a team. So these are very important things. So you have to choose. So first of all, for my case, it was a lens. So I also need a manufacturer. So it's not that I have to do everything on my own. So that's where you start looking for a reliable partner, but it might vary for your product or what you have invented. So we partnered with Apasami because at that time they were also innovators in encouraging youngsters to bring out with whatever innovations they had. So I explained the idea to them. But then there are hurdles. The company thinks only about the financial aspects and you think about getting something invented. So there's always a clash. So the initial phase will be very difficult for you to convince them that but unless you do the trial and have the research done, you cannot prove anything. So there's a gray phase always, and that you have to all overcome very strongly, and you will have to pitch it to them. So I think that is why like some programs like Shark Tank, I think Venkatesh here, sir, because without Venkatesh sir, even I wouldn't be standing here because of his programs that what you see on TV, that you come and pitch your idea, and then it doesn't stop there. You have to take it to the next stage. But we had a clear vision, so I wanted to treat these aphakic patients better than what they ever done before. So you should also be clear about what you wanted. And this was the first prototype design that we had in 2018. So then I said, so once you have the design, now all the hurdles that start coming. So first of all, then I learned from Suvin sir about patency, because he was the one that time had done the BX ring, and he was very kind enough to say like how important getting a patent filed for whatever product you do, because all of you might have, because you never know. See, we are a vast population, and this helped because at the same time, during my journey of patent filing, after a year, I found out there's another lens like a Caravelle lens, which is very common in Italy, and he also had started at the same time. And then 1 year later, we found out you all must be knowing about the scleral tuck lens that's also there. So that's also another type. So getting your patent done for your design and applying for the patent before starting your work or telling it to the outside. See, in 2018, I could have presented about it, but then that is not the right method what I've seen. And many things have stopped at that time. So make sure you have your patents done, all your regulatory approvals. So then only I learned that every lens, that whatever IOL we use, we has a CE certification, a mark, a license and all this. So you learn about all those things. So licensing is very important, because without licensing, they cannot sell the product. Then for you to do the study, like how nowadays ethics has become a very important part for your thing. So you need the ethical clearance before starting off with the trials. So these things also you should have somebody who can guide you in that, and make sure all this is done before you start your thing and before you talk it to the others. It is not about coming and showing what you have done, but you should first see whether what you believed in is actually working and it is benefiting. So it took us 2 years to get the certificate approved. So it taught me that I also had to go to court. I had to face their questions. So it was not about doctors or anything. It was just about the design. So it's a totally new dimension that I had sitting there, and non-doctors asking me questions about the design and what is aphakia and how it is useful. And then successfully after 3 years, we launched it in Salem in 2020. That time Dr. Mohan Rajan was the president, so and Satyan sir was there. So we had a very successful launch in TNOA, and then subsequently the 2 months following in All India Delhi. So we launched it in Delhi. So, and that is when the lens was supposed to be released. The day when we landed back in Chennai that weekend, that Monday, I think the lockdown was announced, and that was the starting of the COVID. So what again I'm trying to tell you is there can be various obstacles. The day I launched and even before I could sell the first lens, and this is what happened. So you always have two choices again. So again you can be sad and keep cribbing about what happened. How I believe is you take every negative criticism and try to turn it into positivity. It is very easy said and done, but I have grown up like that. So when people say I can't do that, I try to do it. When they say you are not doing that, I still try to do it. It is not to prove them a point, it is to prove yourself, and that gives you that you go out of the comfort zone to do something extra. So then it actually gave me time to rethink, reevaluate about the design, everything. But that time I came up with some new instruments also. I said, now we have the lens, but we might have some specialized instruments also designed. So why not have it as a kit? So that's when we introduced the CMT Flex kit, and then we modified the design to make it less bulkier what you see from the previous design. Then I started the study, and then people started using it. So as I said, it is not only you, unless other people, like this is, we are in the field of ophthalmology giving vision, so we all have the common goal. So unless people use it, and their feedbacks are very, very important. There again, I'd like to quote only Venkatesh sir. From the day I introduced it, he must have forgotten, but till today, every time I present everywhere, he comes up and tells me what has to be done and what should not be done. He told me on day one when I let it, do you have any publication? I said, no sir, I don't have. Do you have any study about the sclera and how this sits over the sclera? No sir. Have you thought of doing OCTs? No sir. So every time he said something, but I went back. I was not a student like that. I was always the last bencher in my class, even till today. So, but everything he told me, I took it up and went back and worked on it. Because that is what has added up to me, for me to think outside the box and what else I have to do. And then I came out with the publications, the local journals, the national journals, the peer-reviewed journals, PubMed index journals. But there again, I worked with my team. It was not only me. You saw Prasanna presenting here. So we worked together. Dr. Madana Gopal also. We all worked together. So I did a couple of multi-center studies. So now to show you about the clinical aspect also. So it is basically for aphakic treatment. So this is a case of an aphakia which was planned for a secondary CMT Flex IOL. So we usually mark 0-180 degree and make 2 by 2.5 flaps. And then you make a sclerostomy 1.5 millimeters away from the limbus. So these are specially designed Pranav forceps. This is 1.5 millimeters away from the limbus. The other advantage of the lenses, it can be done through a clear corneal incision. So initially we were doing here because we were all used to clear corneal incision here. Then I thought, why not? Because it is easier to grasp these lenses rather than going here at a 90 degree angle. So this we call as the head-on position. So initially I was holding the neck of the part. So what happens is that time there's a bulkier portion that comes out. This is a head-on position. What happens is when you're pulling it out, you see the 2T bends inside. So that's a lesser diameter of the lens that comes out. So that makes it smoother for the lens to come out through the sclerostomy. And again, being a single piece, I've heard people that there is breakage. So what I say is, wait till you release it from the cartridge. So don't pull it out as soon as you hold the T. You release the remaining of the lens from the cartridge and then pull it out. So then it smoothly comes out, pops out and stays there. It's because of the specialized T-shaped haptics that you don't need to tuck the lens, you don't need to suture the lens, or you don't need to glue the lens. It just sits in the position. But again, the 0-180 degree is very, very important because that's where the lens is going to sit. For the other side, the handshake technique and exchanging to the other hand, being the material it is really tissue forgiving, less traumatic inside the eye, and just wait for it. So once this is done, it is almost over. So you don't have to do anything else. You get nice round pupils. We also have an angulation of the lens. So all these things, developments came because the angulation is given between the optic and the haptic so that there is no rubbing of the iris, no pigment dispersions. As I said, these were the studies of UBM. This is the OCT through the sclera, because sir said in 5 years people are going to ask you what how are the reactions of this material. So after all this journey, then it has been like people forget what you have done 7 years back, but today, so I was happy. But at last, the recognition came when it actually people started using it all across India. So we had, this was last year, but now I think it's cost more than 5,000 implants because it's catching up faster than I do. We have many surgeons. The main thing is I like to thank all the doctors who have tried it and been very happy with it and been using it. So this particular photo was last year's in ASCRS, where I would say, like, when you do something, don't look for someone else, but then it will eventually land you up somewhere if you keep consistently doing your work. So these are the session where they had all the inventors of secondary IOLs. So you might see me hiding somewhere. So this is Kanabara, Yamane here, then Kanabara here, Si Shung Fake, Amar Agarwal, George Baiko, and then so we had an exclusive session on all the different types of thing. So this was totally unexpected. It was giving me over the moon, but that was after 7 years of hard work. So, but the journey did not end there. My learning still continued. So I would always say learning never stops. It's like, I didn't see any seniority or juniority because Venkatesh sir was my teacher from Arvind Eye Care System and Prasanna was my junior. So people have started modifying the technique. And just one small thing is you should always have inspirations. So in my journey, so the entire name CMT Flex, I don't know, even now many of them don't know, it is after my mom. Her name is Shalini and my dad's name is Madhivanan. So that's why the CM came from. I always thank my teachers from Shankanitra and Arvind where I've learnt everything. Yeah, my wife for being flexible and tolerable for all the idiotic things that I've done in this period. And none of this would be possible without good friends. So if you want to achieve something, make sure you have a team with you that understands you and criticizes you, not keeps telling you you're the best, you're the best. It's not that way. My mentors here, Sahu sir is another example. He was the one who introduced me into MSICS and that gave a rebirth and relearning about SICS. See, it is what I'm trying to say, learning never stops. I used to be the fastest in Arvind, I can boast, but then now what I'm learning from SIC is something more different, that even for multifocals through 2 millimeters incisions. So that's what I'm saying. You need a team to guide you and you need your friends to take you along. But take the criticism in a very positive way. So only then you can learn. That's what Deepak sir also said. You try to learn from your own mistakes and be the better version of yourself. But have a dream big and keep working hard. So all these things put together is what the journey is. So I'm happy here and thanks once again to Venkatesh sir, Sahu sir for all their inputs and supports. Night 11 o'clock he'll call me and say, Nivean, is it ready? And I said, no sir, sorry sir, no. So you should get some positive energy and the passion those people have. They say we are youngsters, we are the next generation and all that, but I feel we are a little lazier than them. We have a lot of learning that we have to do from them when it comes to discipline and working hard on something that we want. We are always focused on the results, that we want to be there, we want to be the best. How is that person driving this car? How is that surgeon making so much money? I think all that comes secondary. Give that investment of 10 years.